Okay, so welcome everybody to our December webinar session with the Canadian Shelter Transformation Network. My name is Grant Martin. I am the network coordinator for CSTN and happy to host today's session together. This month's topic is all about impressions of safety and potential barriers to address. So talking about expectations in lower barrier shelters. I want to start by acknowledging that um, I'm situated on the traditional lands of the Haudenosaunee, the Anishinaabeg, the Lenapehoak, and the Attawandaron peoples. I honor and respect the history, languages, and cultures of the diverse uh, Indigenous people who call this territory home, and I'm grateful to have the opportunity to live, work, and play on this land. But I also recognize, too, that the Canadian Shelter Transformation Network you know, is a national network, and so just want to recognize the various traditional and unceded territories across this country from coast to coast to coast, and our commitment to the calls to action from the Truth and Reconciliation Report. And really everything that we talk about in these sessions is really about this piece around how are we recognizing the importance in every topic that we're reviewing when it comes to shelter transformation work is also a part of action for reconciliation due to the harms of colonialism. A few housekeeping items before we get started. Please mute your computer. We will have a Q&A after the presenters are done with their portion of today's session, at which point you can use the Q&A box to post questions in there. But also too, when we get to the Q&A, if you prefer not to use the Q&A box, you can just raise your hand and then I can unmute you to ask, so you can ask your question. Everything from today's webinar will be shared on the CSTN website following the session. It typically gets posted about a week or so afterwards. So if you have folks that weren't able to attend today that wanted to, the session will be posted on the website, the recording. If you don't want your image to be seen in the recording, then please just keep your camera off. But also just important to note too that for any historical webinars that maybe you've missed, they're also archived on the website. Our session today should run no more than 90 minutes, with the first 60 minutes encompassing our presenters and the last 30 minutes for opportunities for questions from the attendees. So this is our outline for the day. You can see there who our speakers are, and I'll introduce them more formally later. But I want to start off by just identifying what our mission is at the Canadian Shelter Transformation Network. We really see ourselves as a network of homeless shelter leaders and organizations that are committed to becoming more housing focused and lower barrier, because oftentimes we are the first point of contact for people experiencing homelessness. And so we see ourselves as a big driver in helping our mission of ending homelessness in Canada. What we do or how we can help some of our activities at CSTN, a big piece is around resource development and capacity building. So we do that in a few different ways. One is we collect and post kind of various resources that we find from across Canada and the United States and host them on our website for you to be able to reference and use to help with your own change work in your organization. So I want to give a shout out to the shelter leaders and various organizations that have shared some of their materials already that have been hosted on the site. I know for me, I would find it really, really helpful if I'm going through shelter transformation work to know that there's some stuff out there that already exists, so I didn't feel so overwhelmed to start everything from scratch. The other thing is we have a community practice that we're developing through a pilot project with various communities in Alberta that hopefully will then turn into a development of national guidelines and a certification process of what it means to be a housing focused and lower barrier shelter. So there's more to come on that. You'll see on the screen as well, there's a QR code. If you are not a member and wish to be a member, which by the way, this comes up quite a bit, is there a fee to being a member? No, there is no fee. Everything about CSTN is a completely free service and resource available to communities across the country. There also is like really no commitment. You can decide how involved you want to be by, attending webinars or maybe participating in leading webinars or committing resources and participating in that way or participating in some advocacy work. But by being a member, you're not committing to anything other than just being a member. So we have this series of webinars that we host. Typically, they're on the last Wednesday of each month. This month, because of Christmas, we've moved it up a week sooner, but they're typically on the last Wednesday of each month, and they're held at 12 noon Eastern time. Uh, we also provide various resources on our website that include things like self-assessment tools. So self-assessment tools that can help emergency shelters kind of get an understanding of where they're at in that change process and where they maybe still need to go in order to feel like they are functioning truer to fidelity of being a housing focused and lower barrier shelter. And then, as I already mentioned, tons and tons of tools and various learning opportunities that are hosted through the website that you can reference anytime you feel like you need it. But also, please feel free to reach out to me at any time if you're struggling with a subject in your shelter and you want to learn from a peer or kind of tap the shoulder of a peer, but you don't know who that peer might be who has some experience in that area. Please reach out to me directly at grant@transformshelter.ca. Happy to act as a broker to bridge that connection to another shelter leader that might be able to help you with some of their experience and expertise in that area. So this is what the website looks like. You just go to transformshelter.ca. The main two big tabs that I really draw your attention to are the resources tab and the webinars. So as mentioned, a whole bunch of resources hosted there, as well as archived webinars that are recordings from previous sessions. This is some of the topics that are proposed coming up. So today's is all about impressions of safety. But I'm really excited too about next month. So January 29th is why data matters, the power of data in elevating emergency shelter performance. And co-presenting with me in that session are two really, really great guys. There's Chris Gorman, who's a senior associate from Org Code Consulting, and then Paul Lewin from Silo Mission. So today's webinar, I think today's webinar is really about an important or several important questions that we often ask ourselves as shelter operators is say like, which rules are the right rules that make the most sense for our shelter? And hopefully in a way that still allows us to be as low barrier as possible, as inclusive as possible, with all kinds of considerations for our staff, for our guests, for the community, uh, to really have great outcomes for people who need our services. But I brought up this slide because I think it's important that we understand that when we take in consideration safety and perceptions of safety, it can feel sometimes like different groups have different perspectives on how safety is achieved. What we can see on the left side there is that for people receiving services, oftentimes it can feel like a loss of safety comes from a loss of control over their lives, right? So we can think about, especially those people that are impacted by trauma, that control and security, or sorry, a sense of safety can come through a sense of minimizing that loss of control over the day-to-day lives, and really about how do we promote safety that allows for them to maximize choice, free from coercion, and then being able to express their feelings and being able to receive consistent information. Whereas people who are providing services, let's say like folks working in shelters, uh, oftentimes safety can feel like as if it's achieved through minimizing the loss of control over the environment. So instituting rules that really try to maximize the routine and predictability of the space, um, and being able to use things like barring or force as potentially seen as a measure to be able to assist with greater safety or perception of safety. So these two things can feel like as if they're at odds with each other. But one of the things that we learned when we surveyed people experiencing homelessness in an unsheltered manner that were not in shelters is one of the most commonly reported reasons for why they weren't accessing shelter was this feeling of too many rules. And so we can't ignore that feedback from people who aren't accessing our shelters when they say things like, I feel like I'm being micromanaged, or someone's watching over my shoulder, or the rules recreate a feeling of some institutions that I may have been previously in the past. And those commonalities are potentially re-traumatizing. And so I avoid that space. And so it leaves kind of shelters in this challenging situation, but a situation of opportunity to say, like, how can we minimize the rules to increase the likelihood of folks feeling like those rules don't act as barriers of entry into our shelter? And so the role of rules is really important to be able to understand is that we really want to limit those rules that uh, follow a specific function or a role in shelters, which is all about maximizing safety. So being able to distinguish between the rules that potentially act as measures of social control versus rules that really just try to ensure the physical safety and integrity for people in the space, but then also the physical building itself. And so it's important to identify that lower barrier does not mean no expectations, right? Lower barrier shelters does not mean no expectations. It also lower barrier doesn't mean high abuse, right, for our staff. So when we're trying to think about expectations, because we're moving towards being a lower barrier, is really, as I've already mentioned, limiting the number of expectations that mostly relate to safety. So really trying to keep it simple and plain language, rules that relate to behavioral issues that could come up in your shelter. Lower barrier also means potentially re-examining your barring process. So like um, moving maybe away a bit for a lot of situations that in the past would have required barring to moving more towards breaks in service or modifications to service that can accommodate the person potentially with a better outcome. And then really trying to make sure that of the few or limited number of expectations or rules that you do have, that they're applied consistently and with transparency. So you can uh, you can be able to articulate clearly to people as shelter guests in your space why those shelters are in place, what role they play, and how you came to adopt those rules. So what's the rationale behind it? And not just that like some staff know it, but all staff know it and can articulate it clearly with shelter guests. And so it eliminates the confusion, hopefully, and the guesswork around understanding what's okay in the shelter and what's not. And the other is that I put it here too, is that if it's important to have it as an expectation or a rule, it has to be written. There should be no unwritten rules and no kind of like unwritten expectations. Write it down. If it doesn't exist in a policy or a procedure of some kind, then it doesn't exist as an expectation or a rule in your shelter. The other is that we run the risk too, when you remember the previous slide, of shelter staff may feel like as if to introduce more rules will create better predictability and control over the environment. And so then they can start to create a culture of thinking that more rules means greater safety. But as some of our speakers will talk about today, and that we've seen in lots of reports in the past, is that more rules does not necessarily mean greater safety for anybody. In fact, oftentimes it means greater likelihood of run-ins that relate to conflict that potentially creates higher conflict situations resulting in unsafe situations. And the other is how do we make sure that any rules that we have in place don't impede someone's ability to move to housing? So for instance, like a rule must be that you must participate in a life skills program that's 12 weeks long before you can even get help from a staff person to help you find your next housing situation. So when we're doing a review of our shelter rules or expectations, ask yourselves this important question. Are your shelter rules ever acting, excuse me, as a barrier to people being able to access or being able to successfully stay in your shelter? I won't go through this in detail, but I thought I'd share this from the National Alliance to End Homelessness. Our presenters will show within their own experience how they went about doing a review of their existing shelter practices and shelter rules and how to evaluate them. This is just an easy diagram as a visual reference to think about the 10 steps to go through that review and determine if you eliminate or keep certain rules or if there's adaptations that need to be made. Real quickly, what's the difference between a rule and an expectation? Because I think, and I'm guilty of this, is to use these terms interchangeably, but they are different things. I think when you see them put side by side with their various characteristics in comparison, you can see how these two things are very different. They both try to maintain some degree of structure and consistency, but I think with uh, the big difference that I see that stands out here, the running theme with rules, is that those things that are rules tend to feel like as if they're things that are enforced and tend to come from a top-down approach, whereas expectations are things that are more socialized between staff and shelter guests and has a coaching nature to it and allows to be able to like monitor and provide social cues as reminders around expectations and feels a little bit more cooperative. So here's a way that you can think about transforming some rules into expectations. Starting with the first one can be a really simple one that we see in a lot of shelters, right? So residents must sign in and out when leaving or entering the shelter to track attendance for safety. A way that we can reframe that as an expectation can look something like this. Residents are encouraged to let staff know if they plan to return late, so others aren't worried. Or the second one where we're looking at is say everyone must follow the posted mealtime schedule versus residents are expected to clean up their space after eating, even if not explicitly required. Or the last one about no fighting or aggressive behavior is tolerated and may result in removal versus reframing it to language that suggests something like this. Residents are expected to address conflicts calmly or seek mediation from staff. So with that, what could a process look like to determine which expectations uh, should we keep or remove? And we have three great speakers here today that are going to talk on that around how they made some of those, their process of doing that internally within their organizations. So today's presenters, we have with us Brian Elliott, who is the Executive Director from the Inn in St. Thomas, Elgin. We have Jasmine Clark, who is the Executive Director from Optimism Place that is located in Stratford, Ontario, but serves all of Perth County and is a uh, domestic violence shelter, intimate partner violence shelter that provides residential space for women with or without dependent age children in their care. And then we have Jamil Mahmood from Main Street Project in Winnipeg. And so welcome, all three of you. Really, really glad to have you here. Appreciate the time and commitment that you're making to join us today. And I thought we would start today off with Brian from St. Thomas. Welcome, Brian.
Thank you, Grant, and welcome everybody. We can move on to the next slide. And so just to give some context about our operation, small 3-story operation. We are sandwiched between 2 large bars and nightclubs and exactly about 90 feet from City Hall. So we're right in the heart of downtown St. Thomas, 40-bed facility with 15 overflow spaces as well. We'll go to the next slide. So, Grant said a lot of great things during his part of the presentation around defining low barrier and safety. And For us, it's been that journey, and I love the character here that your culture will eat your strategy for breakfast. And it's true. And it started really going back with our team and our program managers around, you know, what is our true purpose for being here? Why are we here? What motivates us every day? And then what were the obstacles getting in our way of being successful in different ways, not just the housing aspect, but the supports for our clients, our guests. And so really started to reimagine low barrier. And part of that process was around engaging, like what was the most important part. And I couldn't agree more that, safety is primary to our staff, our volunteers, and our other guests. But more rules wasn't making that happen. In fact, it was creating more and more confusion around, that difference between rules and expectations. And so we really started to look at things in how do we make it simpler and easier for everyone to understand, publicize it, post it, and then continue to adapt it as we needed it. And really, our biggest change, or one of the biggest change from not just our program managers who have done an amazing job coaching this to our team, but to our housing focused case managers was we can hire anyone to say no. It's around finding those individuals that can look for ways to say yes and build that rapport. So we'll go to the next slide. And so when we were talking to our team and then even with our guests around what gets in the way of making more and more progress, and the first thing we really spent a lot of time was on the shelter restrictions and shelter breaks. And so moving from those hard and fast rules, if you do this, you're gone for 7. If you do this, you're gone for 3. And really, how do we adjust terminology to make it easier for those using our services to understand, make it easier for our staff to understand what their abilities were in terms of issuing shelter breaks, and how do we do it in a way that still stays respectful and keeping that relationship with our clientele. And so we really did start looking at how can these restrictions change and what were the issues when we issued restrictions. And part of it was those on a restriction and not able to access shelter were being more targeted in the community, and the fact that so many things get lost when they're not at the shelter. And so we'll go to the next slide. And so are we perfect with our shelter break system? No. And so we're constantly reviewing it. And what I mean by review is if we start to notice that thefts are up, then maybe we have to adjust the break time for that. Or if something else is up, so we can ebb and flow our our restrictions or breaks, based on what we start to see as trends within the shelter. And one of the biggest things that happened in terms of use of terminology was our shelter breaks will say up to so many days, because all of you that are in the system understand that, not all things equal the same number of days for individuals. So when we use terminology like up to 3 days, it gives us a chance to look at that full scenario, understand the individuals, the circumstances around it, so that it doesn't have to be a full period of time. Part of that builds that trust in the relationship. And the other biggest thing that we've done is most of our things start with take a walk, so that before things can elevate, that we can help them de-escalate, move them out of the current situation, have them have some time to themselves, because as we all know in a congregate setting, it's not easy to get that privacy or go somewhere to clear your thoughts so that you can deal with the items that are happening in front of you in real time, always in a calm way. So our job is to help assist that. And we found with the taking a walk and moving from the area and then coming back, it gives them a chance to be refreshed. If it's over shift break, it gives them a chance to come back with a new, fresh staff so that they don't feel like they're still walking on eggshells. They're still explaining what they've done. But also the biggest change was not barring them from all of our services. So we really did make it conscious that they could still use some of our services. And the fact that when cold and heat alerts happen, that process changes as well and allows some dignity. And so we use a lot of terms like amnesty. And so we'll go to the next slide. So dignity is a big issue for anyone that's homeless. And so even when they're on a shelter break, we have the ability through our south entrance to still offer at least bathroom access. Um, Anyone that's on a shelter break will still have access Wednesday afternoons to our doctor and the medical team there so they can continue on whether it's their Sublocade shots for opioid, wound care, prescription management, whatever it is. We never want to see them lose out on medical treatments. If they have partner meetings, we would still allow them access to the partner meeting and then leave the site. And again, cold and warm weather alerts, we will allow or suspend that restriction when possible and have it start up again after those cold weather alerts. And when we say when possible, obviously, if there was a violent situation towards staff or volunteers or other guests, um, we have to try and find other creative ways to make sure they're they're able to be warm. The other issue that we really addressed was around these amnesty bins. There's a small picture on the left-hand side with those little tote bins that you'll see their names in green tape. So one of the things was, para, the items that they use, ID, cash, things of value, they're able to store in these bins with security, and it happens before they're screened to come into our shelter. So then we're not judging what they have on them, but it also really cuts down on people trying to use within the shelter um, and just more safety for staff in that regard. And they understand that it's safe. They can put it there. They're not worried about it during their meal times or when they're getting different things. And then every Tuesday, our program managers and myself meet to look at who's on restriction because there are some individuals on a restriction that will try and earn their way back, whether it's all of a sudden they're shoveling snow in front of our shelter or cleaning up around it. They're doing positive things to try and show that they understood what they did, but they also understand the value of being at the shelter. And our program managers and our case managers can advocate for individuals to have a restriction slightly reduced based on the goodwill that they're trying to earn back from us. And so then what did that mean to our shelters? So it's great to say all these things and do all these things, but what were some of the outcomes that we actually saw within the shelter? And if we go to the next page, so this is the big one. Over the case of 12, over the span of 12 months, we had 23% reduction in police calls to our facility. And we found that through the communication, it was going both ways, not just staff to clients, but clients were coming back and talking to us. And we found that our ability to build those relationships were continuing to improve because they weren't being left out of services or ability to connect with those that could help them move out of shelter into housing. We've seen a reduction in actual physical violent acts in the shelter, and that some of our clients will actually advocate or talk to another client around, hey, calm down. You don't need to do this. And so they understand that we're actually there to be advocates for them and work with them, not against them. And that we were very transparent about our shelter restrictions, and we post them in multiple places. We talked to them about intake, and it wasn't about these are our hard and fast rules. It was around helping set expectations about working together and not using it just solely as a punishment system, but understanding that when you live in a congregate setting, there are activities and behaviors that help make it better for everyone that's here. And there are times where if we make a bad call on a restriction and afterwards we're able to review the tape, we acknowledge it. And so they understand that we're doing our best to work with them, but we are starting to see a very positive interactions with our clients and them understanding that we want them to be here. We can't help them if they're not here. And the more breaks that they have, the less connected to the system they become, more trust is lost, and the harder it is for us to help and advocate for them to get into housing. And so there's my 10 minutes. Happy to answer questions at the end.
Great, thanks. Thank you, Brian. And I'm also like diligently taking notes of follow-up questions that I do want to ask based on some of the things that you highlighted. We're going to move next now to Jasmine, who is, as I mentioned earlier, is joining us from Optimism Place in Stratford, Ontario. Welcome, Jasmine.
Thanks, Grant. Hi, everyone. So just quickly, we are a women's shelter. We serve women with or without children who are experiencing domestic violence. Our mission and vision is that we support women alone or with children to live free of abuse by providing shelter and confidential, non-judgmental services. We're committed to ending the cycle of abuse and violence by raising awareness through prevention, intervention, education, and advocacy. So we are a shelter, but we are much more than that. Women engage with all of our programs, whether they need to stay in the shelter or they don't. We also operate a crisis line. But our community is very rural, and we're a very 9-to-5 community. So not only do we serve women experiencing violence, but most of those women have been displaced from their homes. They're experiencing homelessness sort of in combination with their experiences of violence. And sometimes their experience of homelessness has made them vulnerable to violence, and they make their way to our shelter. We also recognize our role in being housing focused, based on the current housing crisis we're all experiencing. And one thing that we know is that the majority of women who are homeless in our community are because of relationship breakdown. So it tells us a lot kind of about our role as a shelter. So if you don't mind going to the next slide, Grant. Yeah, there's our services, pretty standard. Next slide. So I just want to talk a little bit about our historical versus our current state. About 7 years ago, I started in this role at the shelter, and for the first few months, spent a lot of time just trying to understand the shelter operations, where we were at, what the staff were reflecting on in terms of the outcomes we were seeing for women. And we were very not trauma informed. So we had a lengthy do not admit list. We had, a literal Rolodex on our frontline desk of all the people that were not to be admitted to shelter. We weren't very trauma informed. All of our rules were sort of compliance based. We were really risk averse as a shelter, and that was our organizational culture. We didn't have a standard process for sort of reassessing that list of folks who were barred for various reasons. And what I could ascertain was it was often related to what was considered unsafe behavior, but we didn't have a standard definition of what that was in the shelter. Of course, this surprised me because, the rules and expectations, it didn't happen, it happened gradually and over time, but we got to a place as an organization where we had so many rules in place for so many reasons. That was really hard for women coming in to understand, to navigate those, and a lot of staff time was spent navigating those with women. So The other piece for me is that, those expectations often mirrored the loss of autonomy and sense of control that women were experiencing in their relationships. So we inadvertently were recreating that for them when they came into shelter, and that was often a reason that they didn't come. So I'm going to talk sort of about our current state. We have been in a 7-year journey of redefining the role of shelter. We have increased intentionally our focus on housing. But in addition to that, we've shifted to also being having a relational approach. So I'm going to talk a lot about that throughout my time. And we were focused on reducing unplanned exits from shelter due to guest behavior and conflict. Is often really disruptive. We're a unique environment too, because we have children in shelter. And a lot of those unplanned exits were just really disruptive and really caused a lot of harm, I would say, in the shelter, and created a lot of conflict between residents, between staff and residents, and weren't leading to good outcomes. Next slide, Grant. So like I said, this was a sort of the long game, and we knew it would take time. So it happened at multiple levels throughout the organization. There was pieces for the board to consider. This wasn't about the board making decisions about the operations of the shelter, but I spent a lot of time utilizing my monthly reports to the board to keep them informed as we made shifts. Not for their approval or endorsement, but to engage them in the strategic priorities that we needed to set as a shelter, and to approve a budget that supported the changes that we wanted to make. So I'm going to talk a little bit about those and why it was important for the board to understand where we were going. It was important for staff to have opportunities to provide feedback, and for our leadership team to be really aligned in what we were trying to do. So here's just a few examples quickly, the things that we found really important as we move through this journey. We had to shift our thinking around occupational health and safety and workplace violence. So we had to get really good at articulating what was unsafe versus what was uncomfortable. We did things like occupational health and safety risk assessments. We addressed areas of concern in terms of our environmental design, and we ensured that staff had tools and all the strategies available to them to manage safety or behavioral concerns while they were on shift. So we had to get a good grip on the environment that we were operating in, and the staff training that contributed to actually escalating situations that we then considered to be unsafe. We engaged our health and safety committee in that work, obviously, and the leadership team, was really able to define what's unsafe and what's making staff and other residents uncomfortable, and how do we address those things differently. We spent a lot of time reviewing that do not admit list. There was a real task, but it was really transformative. Because we went through that list name by name, and we realized how problematic it was, how decisions were made by various staff and managers over the years. There was no system or standard process, and the list wasn't reviewed with any regularity. We found some of the barring was dated 10 years prior and was sort of passed down over the generations of staff teams who didn't really know why they were on the do not admit list. So we essentially eliminated that list. We narrowed it down to a few women that we knew we needed to engage in relationship repair with in order to bring them back into the shelter. So we've been, we really don't have a do not admit list anymore. We just have a few flags with women who know that coming into shelter will just require some additional planning to ensure that we can meet their needs and they can meet the expectations in shelter. And we try to be as creative as possible. In that, sometimes that requires us to bring on additional staff when they're staying in shelter. So there's nothing that we're opposed to doing in terms of our creative thinking. So it's not that it's on her back to figure out how she's going to follow the rules, so to speak. It's really, on our staff to be creative and think about what do we need to do to adapt the shelter environment to fit for her. And I know that's sometimes difficult in large organizations. That we're a smaller organization, and we can really take the time to engage with her in that conversation and really understand what she needs from us, and what not only we need from her, but what the other women and children in the shelter need while she's here. So that was a really transformative activity. It took us about a year to do that. So this was not a quick one day reviewing our list. We spent a lot of time breaking that down. And of course, we broke down the rules. So why are they in place? You know, who do they protect? We asked ourselves, are there unintended impacts? We asked ourselves, was homelessness a consequence we were comfortable handing out when people didn't follow the rules? We realized too, when we spent time reflecting on the operational realities of managing all these rules and enforcing them, there was a significant amount of staff time that we were spending enforcing the rules, handing out warnings, and it just increased the potential for conflict. This was actually a huge aha for the frontline staff. They were focused so much on just getting people to follow the rules that they weren't engaging in the real shelter work and the relationship work. And I don't have a doubt that certain shelter guests were sort of policed more heavily than others. So it was really good. Again, it was a transformative process. It moved us towards creating a new shared culture. And it developed and deepened an organizational shared practice of slowing down and panicking slowly. So it's sort of our you know, we live by that at the shelter. The other thing we did, we spent a couple full days articulating and re-articulating our service philosophy internally and centering relationships as central to shelter work. So we recreated our values as a team. We talked about, you know, shelters grew out of a movement, and that movement became a service. And we got too far away from centering the movement in our work. And we started asking ourselves, you know, how can we get back to our shared values? How can we make shifts internally? And how can we ensure that when women show up at our door, they feel a real sense of being cared for, and not just quickly, you know, sort of read the rules of residing here. Can you go to the next slide, Grant? No, back one. Yeah, so Brian talks a little bit about this, so I'm not going to get into it in depth, but using similar language, because I knew this is the language Grant would use. But yeah, we moved away from barring people from the service. So similar strategy where if they need to exit the shelter, you know, it's temporary. And so, you know, barring would be our absolute last approach. We take gradual, exhaustive steps to avoid that where we can. And we're always willing to review sort of each circumstance in depth with the woman and with our team to ensure that we get it right, as I mentioned, for the next time she comes in. We established a harm reduction approach over those 7 years. We had a lot of discussion about the need for amnesty boxes and lockers and how to operationalize this. Seems like a no-brainer. I think most shelters are, you know, on their own journey around harm reduction, but I know a lot really struggle to operationalize the philosophy. So that took a lot of time for us, especially in our environment where children are present. Staff had a lot of fear of kind of the unknown, the what ifs. And so we do have lockers on site. One of the biggest things this helped with was we were finding a lot of women were bringing weapons into the shelter, but it wasn't to keep themselves safe in the shelter, it was to keep themselves safe in the community. And they were perfectly happy to put those away when they came into the shelter. And it just completely eliminated any conflict we had or any conflict they felt around having to sort of give up their weapons. But, you know, and also engaged us in really good conversation with them around their safety planning when they left the shelter. So that's what we did. The other big piece is we reorganized our approach to HR. So we redesigned and updated our training. We invested heavily in crisis and de-escalation training. We totally changed how we recruited, onboarding, and coach staff. And we ensure that each staff has regular ongoing trauma-informed supervision with an experienced manager. So I would say this can't be overlooked for frontline shelter staff. It's a really critical piece, and it's something that we don't compromise. We also design a staffing complement that's appropriate for the acuity we're seeing in shelter these days. So what worked 3 years ago doesn't work now. We need to be nimble. We need to constantly evaluate and redesign where required. And we've started paying better attention to data. We were seeing where staff were getting burnt out or taking more sick time. And we were able to, I think, have a better understanding of how that related to the conflict that was occurring in the shelter, particularly related to enforcing rules and asking people to leave. The piece we haven't figured out yet, I think, we sort of have it backwards where shelters hire entry level, new grads. We still haven't figured out how to create shelter roles to be attractive to those with good experience or towards the end of their career. Because we acknowledge shift work is hard. However, we have been really clear with new staff that this is a 3 to 5 year position. So you're not making a career out of working in a shelter. We've been really open and transparent with staff that this is tough work and it requires a lot from you. And so that's helped because then people, aren't coming into the shelter thinking it's going to be an easy job. And then pacing the change. So we had to move slowly and intentionally through every piece of this. It also was a really important process of engagement across the organization, taking time to hear everyone's perspective as we move through, and engaging with women that we were supporting to guide our decision-making. So just next slide, Graham. So this is the key takeaway, I think, that I want to articulate. What does it mean to create a relational approach in a housing-focused shelter? So I've talked about this sort of throughout the presentation, but this is where we're focusing heavily these days. We're learning that facilitating daily meaningful activities and engaging the group in shelter and creating a sense of belonging and community is actually leading to the expectations being socially reinforced amongst the group. It takes staff sort of out of the equation and out of the role of mediating more often. We took some time earlier this year to ask women what they want and what they need while they're in shelter. They didn't identify housing being, despite being displaced and currently homeless. They didn't identify a specific program as their first priority. They said a sense of community and belonging. So as much as we know it's important to be housing focused, because after all, no one lives in shelter forever, we've made a major shift in first being relationship focused in our programs and truly being great hosts. We've noticed strong correlations between the invitation to daily group activities and less conflict and problems that we have to manage in the building, therefore freeing up staff time to do the work of shelter towards housing, and doing that job better, knowing that women have established a therapeutic relationship with us, and when we do have to have difficult conversations, it's a little bit easier. So we use both our internal staff and external subject matter experts to ensure we have a comprehensive menu each week for women who are guests at the shelter. And we aren't so worried that that might be an incentive to stay longer because they're invited back once they depart from the shelter to participate in those groups. So just really quickly, a couple sort of practical examples. We introduced in an artist in residence program. She's there every Tuesday. We have almost everybody in the shelter participating in that every single Tuesday. They look forward to it. It gets them through the week, gives them something to focus on. And like I said, often women come back and participate in that program once they've left. Creates that sense of community. It creates some empathy between staff who also participate in the women in shelter, and we really get to know them. The other thing we do is to staff, when someone comes in and they get a tour of the shelter, fairly soon after that, they get out of the shelter together. So they go learn the bus route together. We cover the staff time at the shelter while they go out, engage in relationship with her, show her the community. So we found that to be a really effective strategy, and just we use that opportunity to talk about life in shelter, what they can expect. And it's a good way to, focus on that engagement. And then the last piece really quickly, we consider, next slide, Grant. We consider our shelter as one of the most valuable tools in reducing stress, agitation, and sort of negative stimuli that might result in conflict in the shelter. And so we used to have, our shelter was built in 1994, but it was very institutional in design. We had 7 rooms. They were all the same size. They were side by side. We had families mixed with single women. There was roommates, room sharing. And our playroom was in the basement and the rooms were on the third floor. We had one kitchen, 2 living rooms, 3 shared washrooms. And one of the things we habituate to as staff is all the disruptive noise and alarms that our shelters make. So we were lucky to go through a major expansion recently. And not only did we get to build and design a new space, we updated all of our existing space to be what the new space looks like. So now we have dimmable LED lighting. We chose warm colors, rounded corners throughout the building. We don't have roommates anymore. We designed bedrooms of various sizes. They're soft decor. We spent a lot of time figuring out what alarms we need and what can be silenced. There's large windows, all of these things. All that to say, I know that not every shelter has, the opportunity or ability to do all these things, but you could do one of these things. And you could slowly sort of chip away at your space and the design of your space. Consult with those that are living there, and ask them, what's this experience like? I don't think we spend enough time thinking about the space we have. So I would encourage us to find opportunities to rethink shelter design. And that's it.
Hey, thank you, Jasmine. And I mean, I think about like in my travels across Canada, meeting with different shelters, and they talk about sometimes like, what are those common things that seem to like initiate people to escalate that leads to conflict and negative interactions? Really small things. It feels small, but has big impact. Like, how are you waking people up in the morning? What is your lighting like, right? Like, how do you serve meals or how do people have access to food? All those things are really, really small ways that are changes that we can do without new money, that just changes the setting for like how people then feel on edge or not on edge moving through that space. So I appreciate you bringing up those space considerations. I also love too, like in our time working together, if we don't create amnesty boxes sometimes for people, what we saw was their weapons get hidden in the bushes just outside of the shelter and in the neighborhood, which is a huge public safety concern. So better that we find ways to store it in a controlled environment. Otherwise, everything outdoors becomes an uncontrolled environment for weapons and things like that.
Yeah, it's a good point, Grant. We, when we had a rule that you couldn't have weapons in shelter, yeah, they would just store them in the bush across the street. And the neighbors were never very happy about that. And we exist in a neighborhood. The shelter was built sort of on the outskirts of town in 1994, but now we exist in a residential neighborhood, and we take that role seriously. We want to be good neighbors. We want our neighbors to engage with us in positive ways, and the women that are living with at the shelter. So that was it. It had, when we asked ourselves, what unintended consequences does this rule have? It was much bigger than just the individual. It was about the community that surrounds the shelter.
Great.
Well, thank you.
Thanks, Jasmine. Okay. Next up, Jamil. Welcome, Jamil.
Thanks for having me. Yeah, I'm Jamil. I work at Main Street Project. So go next slide. I think I'm gonna echo a lot of what Jasmine and Brian said, so I'll kind of not go into detail on points that have been already said, but we are a community health center, and that's an important distinction for us between a lot of the shelters aren't considered community health centers. We frame our work around social determinants of health, and that's also an important part of how we do our work. So I just wanted to make that point. We've been around since 1972, so 50 plus years. So I can go next slide. I think a big part of when you think about making a change or making changes in how you do stuff, for us, it really came down to making sure we set our vision, mission, and values and our strategic direction very clearly, to set how we train our staff, how we work, where we're working from. Like that was the key for when we start to see change in our organization and our approach. And so really important that this process took a little longer. They take time, take the time you need to create the guiding documents you need to guide your work. And then for us being around 50 years, like things have changed a lot in 50 years and approaches are different, like mindsets are different. So really making sure that this work was done with our board and with our staff to make sure we set a path forward that we could then train on it. And a big part of that was our values. So if you go to the next slide, what I found when I started in this role 4 years ago, we had alluded to values but never defined them very clearly, and didn't really live them necessarily, like they're part of our work. Like any document you create is just a piece of paper unless you like try to live those values. So we really dug into like what it meant to be a harm reduction organization. And then really centering our work around anti-oppression is key to our work. And a lot of this work is internal, like really understanding the oppressions that our work creates for the people we serve in every way. And I think that's basically what this conversation is over about. It is that the structures you create cause harm or create challenges, and you should be accountable to what you're creating in those structures. And that's what kind of our anti-oppression approach is, really like being really reflective, looking at ourselves first, our work first, and then not building systems that perpetuate systemic or cultural oppressions in our spaces. Reconciliation work is key to everything we do. We are very much in our truth and reconciliation phase, so a lot of learning about our past harms that our organization may have caused in the community, working 50 years. The approach has been very different over the years, and so really understanding that, how we connect to our community members and the supports we provide from a reconciliation lens. And then being trauma informed is key to everything we do, that we're not perpetuating any further trauma in our work, and we're doing everything we can to minimize those traumas. Go next slide. So in terms of an organization, just quickly, we do a lot of things, and so a lot of people know us as a shelter, but we, on top of shelter, I'll talk more about shelter in a second, but we provide complex case management in all of our program areas. So it looks different in each program area. Our largest group of case managers work in shelter, but we have them in our withdrawal management services and housing services throughout. So the roles change in terms of what kind of case management work they're doing, depending on which program they're working in. We run a transitional housing unit, a 28 unit. Transitional housing stays for up to 18 months, and really focused on getting folks off the street to the first housing option, and then finding the right permanent housing option from there. Then we also run what's called the Bell Hotel, which is a permanent supportive housing unit. That's 42 units that is permanent, so folks can live there as long as they want, but has 24-hour supports built into everything we do there, including meal programs, managed alcohol programs, and cultural programs. And then we run 2 withdrawal management or detox programs. So it's 14-day detox program for folks. So a lot of people, it's their first step to recovery is going through detox. We provide all the free detox service for the city of Winnipeg. That being said, you don't have to be on a recovery journey to access our detox program as well. So lots of folks from shelter will access for the 14-day period a chance to take a little bit of break. We call them health breaks, and their goal may not be to go to treatment or that, but maybe just come out in a healthier way than they were before they came in. We do run an intoxicated person detention area. So anytime the Winnipeg police pick up somebody intoxicated in public, rather than arresting them, they transfer the care to us. We provide supervision until people are sober, and then they can go back out into the community. And then we have 24/7 community outreach. Right now for the winter, we have 2 24/7 vans on the road, primarily supporting folks in encampment or sleeping rough. And then we also have a third outreach van that's focused on sexually transmitted bloodborne infections for folks in encampments, and providing them connections to primary care and other services like that. And then similar to case management service, we have connections to culture and healing in all of our spaces. And it looks a little different depending on the space and program in terms of what those services are. You can go next slide. Our 5-year strategic plan was really important. We were fortunate. We worked with OrgCode on developing this, and so that was a really great process. We did it during the pandemic though, so I don't recommend lockdowns for strategic planning. It makes it hard to bring people together. So really focusing on, and we wrote our strat plan a bit as a way to acknowledge the work we've done in the past and some of the challenges in the work, but then also a guiding path forward for our work Next slide. 4 key objectives in our strategic plan. One is advancing and implementation of harm reduction, really focusing on being low barrier, being peer led, and then working on building the harm reduction services. We also want to be really cognizant to write the plan in a way that not necessarily our organization has to lead everything, but we should be participating in helping that leadership develop in things like developing the first safe consumption site in Manitoba and things like that. So we're actively participating as community partners, but we're not the ones necessarily developing the work, but make sure that work's advancing to support the community that we serve. You can go next slide. Preventing any homelessness, so really focusing on being housing focused in all of our work, and I'll talk about this a little more later on, but really that kind of changed how we develop our staff roles and our positions and making sure that the supports are there for folks as they're exiting, but also supporting them while they're housed as well, and so that they're not ending up back into homelessness after that. You can go next slide. Embracing truth, reconciliation, decolonization, anti-oppression, really centering our work around this and figuring out how to do this well. As a non-Indigenous organization, really understanding our position in this work and how we build those pathways into healing for people is super important to our work, but doing that with Indigenous partners and making sure we're not taking up space where we shouldn't be in our city and in this work. I think go next slide. And the last slide is really focusing on how we strengthen our organization itself. And often these things kind of get missed in the broader visioning of an organization, but really making sure we have good data systems, filing systems, everything like that, so that we can do our work well and have the information we need to inform our work, but also in how we develop our partnerships and collaborations across our sectors. The next slide. So our shelter, it's 120 bed overnight shelter. During the day, it transforms to 60 beds, and then half the space becomes drop-in space. We're the only shelter in Winnipeg that provides daytime sleep services for folks. We have washroom, showers, 3 meals a day, case management services, harm reduction available all the time. We see on average 230 to 206 people through a 24-hour period. We are often over capacity, but we kind of flex space. We also allow people to come and go at any time as well. So that's why we are often higher numbers, because we'll have folks that come in 5 till midnight and then leave, and then we have folks that come in at 2 in the morning, and so it's kind of always a flow of folks. We're a little more focused on the lowest barrier we compared to the other shelters in our city. So really folks that maybe get kicked out of other places or other places with more barriers, maybe is what I'd say. They'll come to us if they're not able to attend other places. And we have a pretty good system between all the 4 major shelters in our city to triage folks, make sure that the space they're in is the best space for them to be successful and supported. And so if folks aren't fitting in well at our space, there's often calls made to other places where there might be a bed available or a place available for folks, and coordinating that's really important. And then we also provide both during the day, it's co-ed sleep, but at night we have a section, women only, a co-ed section, and then a men's only section. And that's really helped. Having a co-ed section has really helped provide folks who are maybe in an encampment with a partner that not wanting to go to shelter where they may get divided from their partner, and then they stay together in our space versus being divided by gender or whatever other divisions are created. Go next slide. So our shelter transformation is ongoing, but pre-pandemic we had a tiny space with 75 mats on the floor. And so during the pandemic we quickly renovated a new space. So now we're 3 times larger space. We have 120 cots for people, 10 washrooms, 7 showers. Before we had 3 washrooms, 1 shower. So really creating those essential basic needs services in the space we have. So not only did we transform space, but we really focused on a new staffing model. Our previous model was as we kind of had minimum staffing as possible because we were funded a lot less than we are now, but we added a lot more staff to accommodate the larger space. We developed really clear defined roles. So like Each shift, I think, has 8 staff on, so each role there'll be an intake role, someone who's at the front desk doing intakes and that kind of coordination piece. Then we have a staff that's dedicated to doing, the general safety checks of the area, check the washrooms, washroom checks, check on folks for, overdose response, things like that. And then other folks focused on resource connection development, other folks focused on having housing conversations, and then other folks focused just on that relationship building piece. So, and having these roles for staff allow them to rotate in, and kind of determine each shift who's in the right headspace for relationship building and who's maybe not there that day, kind of having that flexibility to factor in the fact that our staff are human. While they are, yes, superhuman, but they also have those human emotions. And so creating a model where there's ability to rotate between, for the teams to identify who's in a really good place for having those relationship conversations, who's a better place to maybe do some intake work or something that's a less, maybe less engaging, and having that flexibility in all the roles and planning that out on each shift has really been great. We instituted having team leads, so just another, helping with quick decision making and crisis decision making, having someone designated to be that lead. And then, as I mentioned before, being really focused on housing and resource focus, as part of all conversations when you're talking to people. A big part of our work too is our building connections, culture, and healing. And so we've created SCABE roles in all of our programs, but in our shelter specifically, these are about helping people connect to medicines. And so providing things like opportunity to smudge and connections to other medicines in shelter. This has really changed the dynamic dramatically just by even having the ability to smudge in our shelter space and things like that, but also having people there to support people if they don't know about the culture or learning about it or teaching, but then also helping them walk through and understand what different medicines can provide, traditional medicines, things like that. Just having that available to people has changed kind of a lot of our kind of situations that may have been more intense seem to have been calmed down much quicker, just having that presence in the building. And then really helping folks. We talk a lot about folks building their bundles back up, and a lot of folks that we see, especially if they're coming from northern or remote communities that end up in the city, will there's some shame and stigma around going back to your home community if you're dealing with things like mental health and addiction. And so a lot of our work is about helping folks build up their bundle so they can go back home if that's their intention in a really good way. So they're going back in a way that's not creating more trauma or adding stigma to any of the challenges they're facing, but building up their bundle so they're confident in their healing journey and they're addressing all the traumas. And then more broadly, we really looked at the sector as a whole, has seen broader shifts. A number of shelters who were abstinence-based have switched to behavior-based services. We created an Indigenous-led shelter in our city, which has been great. And so really looking at where there were gaps as a sector and filling in those gaps with important services and adapting, shelter models haven't been adapted a lot over time. I'm glad there's groups like this that exist now to have these conversations, but they were developed often to address the challenge of single men as homelessness, and that's the face of homelessness is much different. So really make sure we're adapting collaboratively as a sector and that everyone's doing the work collectively to make sure that that's happening across our city and coordinated and communicated, so we're all in the loop on each other, what's happening, those kind of things all the time. You go next slide. So one of the big parts was transitioning from having rules to more of a code of conduct based approach. And so being focused on anti-oppression means we really looked at why we had the rules and what they were being used for, and if there was a point to them or not, right? And the shift to more of a code of conduct that not only applies to shelter community members, but also to our staff, and we make it very clear like what the expectations are for our staff and our behavior, and that's part of our code of conduct for everybody in this space. And that was a really important breakthrough point when we started having these conversations with community members to really, this is about building a community space that is healthy for everybody, and that involves both accountability on the end of community members, but also on our staff and how we're working. And And that really helped have these conversations in a really good way. Community members are consulted in every aspect of a code of conduct, so they're creating what is in there, and we revisit every 6 to 8 months, or if there's events that occur that kind of require revisiting, we're always kind of reviewing and talking to it and having conversations, and we always talk about it as kind of a living, breathing kind of policy or document. And then also like really focusing on safety for everybody and what that means to keep each other safe, and having those conversations tends to de-escalate or reframe kind of tensions and things like that as they come up. When you remove when you start removing rules and focusing on behaviors or problematic behaviors, it allows you to have much different conversations. It takes away a lot of the policing elements of rule-based kind of management, and really gets away from kind of arbitrary decisions being made by a staff person versus coming up with shared solution or solutions that work for everybody in a good way. And making sure that we are meeting individual needs and meeting people where they are at is a key part of everything we do. And then also rules tend to focus a lot on property protection and those kind of things. And so really important to move away from caring so much about a wall over caring more about the person. And I think it's a bit of a default or maybe a trauma response from staff to maybe focus on the property over the people sometimes. And so really working that out, that we'd much rather you punch a wall than a person 100% of the time. And so we can always repair drywall, but you can't necessarily always repair relationships in the same way. And so really making sure that that relationship is key to everything we do and how we work. The next slide. So restrictions and reintegration, this is also a very living process. We focus a lot on kind of the restorative justice model in this. So understanding what harm is done by actions, and then doing things to rebuild trust and care in the work. So we try to keep any restrictions to be super brief or minimum. Sometimes it's often just take a 2-hour break, or take a break for this shift and come back for intake at the next time. Could just be enough to give that person the time to cool off, or take the have a second thought and come back in a way that they can engage positively and with our staff. So really focusing on everything being brief and short term. And then if there is broader concerns or stuff like that, then we have a reintegration process. And so our process is that our leadership reviews every restriction put in place immediately, so right away. And then we built reintegration team, so there's a representation from each. We have 3 shifts in a 24-hour period, so there's always someone from each shift present. So that helps if the dynamics are different on a different shift, then you kind of get that input from everybody. Also, if an incident involved a threat to staff or harm to staff, they're also involved in that reintegration process and that trust rebuilding. So they'll always have a choice to participate if they want, but really focusing on a lot of the work is can we repair any harm that might have been done between a community member and a staff in those situations. And then we focus, as I mentioned before, on addressing what the behavior is and how that person can safely participate in our program. In cases where a restriction is longer, we always work to make sure that there's somewhere for them to go in another shelter, another space in our community, so people aren't just left out. And that's a big part of having a broader sector coordinated and communicating together. The next slide. So keys to our success is an anti-oppressive framework, and our anti-oppression work starts with individual training for our staff. We do a 3-day training for all our staff that the Manitoba Harm Reduction Networks provides around harm reduction, anti-oppression, liberation theory. That really just, for us, you can provide trainings on the job that and talk about values, but giving folks that time to actually work on this stuff, especially when you talk about anti-oppression is really for each individual to unpack kind of what they're bringing into every situation, and their biases and judgments, and the more you can kind of allow staff the ability to do that, I think the better they can engage and do a better job at their work. But it takes a lot of time and energy to do this work, and people have to be committed to it. And we've lost people because they didn't want to commit to an anti-oppressive framework and living up to our values. But that was good in our minds, that those folks weren't the right people to be working in our spaces. Meeting people where they're at, so making sure we're not putting anything in place that puts barriers or challenges for people to access the service and care we provide. Always acknowledging that people are the experts in their own life, and they know what's best for them. Respect and dignity at the core of everything we do, and that understanding that our spaces belong to the community we serve, not to us as an organization or staff. It belongs to everybody. And then, as I mentioned before, the values of the organization set the actions that you have in each of our spaces. So that's really the key. Hope I didn't go too long there, but thanks.
Thanks, Jamil. And before I go into kind of some examples of also like ways that you can like disseminate information visually in your space, I just want to highlight a few things that I think that were like standing out as recurring things across all the presenters today. One was like this idea of like your best, it sounds like one of your best safety strategies when working in shelters is like viewing the work as relational as opposed to transactional. So that's a really important piece of like getting to know people. The only way that you can get to know people is to get out of your offices or get out of your like staff bubbles and like work the floor, like be in that communal space together, like get to know people, get to know what works with people, understand their motivations, things like that. The other thing that I heard too is like this piece around even when there are situations where there's potentially service restrictions or breaks or whatever it might be, all three of these presenters really promoted this idea of creating a culture in their shelters of reconnecting or readmission or whatever it might be, like mending that relationship back when there's been a bit of a break. So not to say goodbye forever, but how do we recognize that a critical incident occurred? What was that situation? What was the behavior that was the issue? And then how do we acknowledge its impact and be able to restore or like repair from that incident with all parties that were involved to feel like people are heard in that readmission and repair process. So I wanted to bring a few of those themes out there that I heard really quickly before we move into questions. I just want to show too, like, here are some examples, like there's from like the Calgary Drop-In Center, like a simple way of showing like guest rights and guidelines that can be posted clearly in a space. Keep it clear to like one page, but also make it clear around if they have a concern about something that's happening in the shelter, what does that grievance and complaint process look like? Who can they contact? Stuff like that. Again, borrowing from the Calgary drop-in, another one pager where it will just show like things around explaining the building guidelines, if there are restrictions for service, what are those situations? But I would also say too, like what I heard from folks too is like slow down your intake process to make sure that people, one, are comfortable and familiar with your space and how to access it, especially in those early days when they're new to the shelter. But then are they clear and ask questions if there's anything confusing about your shelter rules before you end that intake conversation? But also, I don't know about you, but if I were to go into shelter, I'm very overwhelmed and I might only be hearing tidbits, like pieces of information. Most things are flying by me. So having that openness to like follow up the next day after their first night in shelter and be like, maybe we should revisit some of these guidelines. Is there anything that's unclear now that you've had a day to think about it? Stuff like that. Here's an example of, ooh, look at that animation. Of an example of like also a different way of looking at it is like you can look at it from like how do we talk about drugs? How do we talk about respect of property? How do we talk about being a safe place for all or people's right to privacy? So really simple graphic as a way to kind of show it to people in the space. Another way to look at it is something like this I saw, where it's like a visual, really, really simple. It's about, we all have this shared responsibility about kindness, safety, privacy, and respect. So when there is this follow-up about someone's behavior, it's like, okay, well, how did that actually allow for people to feel like they had privacy when you did this, right? Another way that you can look at it is something like this is just a list of really basic rules, but they all directly relate to health and safety stuff, including like smoking only in designated areas and making sure that people know what those designated areas are, how to access them, and when they're accessible and things like that. So those are just a few examples. They'll be in the slides if you're thinking about how to create visual representation of kind of the guidelines for your shelter throughout the space. But we're going to move over now to, I recognize we have 9 minutes, but that's okay. Are there any questions from folks from our attendees? I'm going to check the Q&A box. I'm not seeing anything in there, but you can also just raise your hand and I can unmute you. Not seeing any yet. Okay. I'll ask a question. A lot of folks talked about, I think everybody talked about a little bit around that people who access the shelter as shelter guests or who have access the shelter to like be a part of that consultation process of revisiting shelter rules and expectations, things like that. But this actually came up when I was working with some folks in Nova Scotia, as they said, yeah, but like sometimes we would be part of a consultation process with clients where their recommendations don't align with the values of the organization or being lower barrier. So, what do you do when a shelter guest, when you do that consultation, says things like, well, we just shouldn't allow anybody who's drunk, or we shouldn't allow anybody who's ever been to jail, or we shouldn't allow anybody who's ever been violent? How do you deal with those conversations, respecting the consultation process of shelter guests, but still keeping alignment with the values that align with being a lower barrier shelter? And anybody can jump in.
Yeah, I mean, for us, it's just, it's a process of unpacking, what makes them uncomfortable about that. It's often because they've had an experience, where that's impacted them. But I think it's just about creating a shared sense of empathy and, understanding that every guest has a right to be here, and we all cope differently. So for us, it's really just engaging in those conversations. It might take more than one conversation to get to a place where everybody's comfortable.
Mhm.
Yeah, I would echo that. I think it's I think it's about humanizing the challenges people are facing, because like and I think that's what the community you're building too, right? Like it's a community, like our community really looks out for each other. They're always like supporting. So if and so I think, yeah, like I used to do a lot of work with gang involved youth, and everything that they used to be like, they did anything bad, they should be banned forever. Like, and they're like, but then they don't have any of their friends, and they don't have any of the community, and they don't have the supports they need, and we start framing the like what that means in terms of, if you exclude people from spaces or they're not accepted, then people tend to have a different conversation. And I think we also have the value conversations with our community members, not just with our staff, because it's a part of our work, is that we live the values in our spaces, and people connect to those values. And I think what usually those very harsh reactions to like not having anyone intoxicated or things like that are coming from a place of fear or past experience. And so if you can work through that with what they actually want to achieve with those comments, and talk through that, you tend to get to a place where people really care about the other people in our spaces, and want the best for them. And so knowing that them being outside the building isn't the best for them usually allows them to either soften that stance, or have a bit of a different conversation on that.
Great.
I think they answered it perfectly well. You listen, and then you
Uh-oh.
come back and
Mm.
you
Uh-oh. Brian, it appears like you're having some bandwidth issues, a little bit crackly and frozen now, but I think we kind of got us like this piece of listening, hearing people's concerns, but also figuring out like value alignment, right? Like and like which it sounds like people genuinely want to make sure that people have somewhere to go. So how are we making sure that we're not alienating people from a space? I'm gonna go back to
Yeah.
the Q&A box for a second. Okay, sorry. Go ahead, Jasmine.
I was just gonna add too, Grant, sometimes it's helpful when we say things like, this is temporary, you're not living here forever. There's pieces too, when they go back into the community or they're living in housing, they're gonna experience similar conflict or similar, they're gonna have neighbors and they may not agree with their behavior. So it's a great way to sort of engage in some of that. We see that's effective beyond shelter, is if people can learn to coexist, despite what they're coping with and what's happening, it's hopefully going to lead to better housing outcomes too.
No, that's a great point, right? It's shelter can be a practice ground for managing relationships when once housed. I see we have a hand up from Brittany. Brittany, I've just unmuted you. Go ahead with your question. But you may need to unmute yourself. There you go. Brittany, do you have a question? I'm not sure why we can't hear Brittany.
She says in the chat it was a mistake.
Oh, okay. Sorry about that. This is also the problem. Like maybe I should get some admin support for these things because it's hard to like MC something and do and look at chats and Q&A. So I will ask because this comes up quite a bit too, and I think about Jasmine, like you're also managing some logistics that may look a little bit different because you do have women and children in your space, but it also is consideration around for single adult shelters. What are some really practical ways that we can still accommodate someone who is showing up to shelter, but maybe they're under the influence of drugs or alcohol or escalate, but um, they're being disruptive to the space, but we don't necessarily want them to leave, but we do need to be mindful of kind of other people, what they're witnessing or what they're exposed to could be harmful. So like,
Yeah.
how do we help that person stay situated in our shelter even while those behaviors are going on?
So for us, we still invite them in. We created what we call a short stay room. So we're not bringing someone in, doing a full intake, or even if they're a current resident and they're coming back and they're in a state where the behaviors are going to have an impact on the shelter, they get to stay in the short stay room, which is proximate to staff, but sort of a little bit removed from the communal pieces of the shelter. We find that works really well. People are happy to go to the short stay room. They kind of know that that's what's going to happen. And so it works.
Okay.
Yeah.
Thoughts from Jamil or Brian?
Yeah, I think that comes to focusing on behavior, right? Like I think like it doesn't matter to me if someone's intoxicated or not, it's how they're behaving and that piece. So I think if you can have a conversation around the behaviors or any problematic behaviors and addressing those, when people are not responsive to that, that's a challenging part, and that takes having good staff that know how to, either de-escalate or refocus folks, and but having some programming options in spaces. We do karaoke all the time and things like that people like often can distract folks or keep them busy or engaged, and usually helps them move on from a more challenging situation to a calmer one, and figuring that out. But that relies heavily on the relationship staff build with somebody, because if you have that relationship and someone's not in their normal state of mind, usually there's a way to use that relationship to get through to the person in those challenging times, right? So
Great.
I think the other piece is if they're not ready for the conversation, circle back, right? It's not a one and done. Are you okay? Yes. Okay. Sometimes you need to circle back, because find the time when they're vulnerable and in the right mindset to have a better conversation.
Yeah, that's a great point. And I think too, like, let's remind ourselves that when someone is in crisis, let's say, whether under the influence or not, they're experiencing an amygdala hijack, right? So they're not processing and like problem solving. So it's not the time to be like, um, being like, you shouldn't do that, and here's why, da 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 da. They're not hearing that. So like, let's use our trauma-informed approach around how do we help get them back into their window of tolerance? And maybe that is a lot of just validation, like softly encouraging them to a separate space where it's not creating issues for others, um, and allowing them to kind of, yeah, remove the hijacker from their brain in that moment by using like what's an appropriate level of engagement when they're at that escalated stage. Um, I appreciate too the piece that keeps coming up about relationship, because we're only going to know what works with folks if we practice stuff with folks, but then also when we do things like post-incident, maybe part of that reintegration or readmission thing is to say like, hey, here was the incident. Also, here's what we tried with you. Uh, what worked, what didn't work well, what should we consider integrating into our engagement with you when you show up in this way? Like what are you gonna find helpful? And like what's more important to that too is like what should we avoid doing? Um, so we only have the ability to gather that intel to have better de-escalation engagement with people if we look at readmission and repairing that relationship. Here's what I'm going to propose. We're at 92 minutes, which is 2 minutes over what I said the max was. So I'm going to move into thank yous. And but before that, I just want to also say for all the attendees, thank you for attending. If you have questions, especially just around things to use, things to consider for like small or big situations in your shelter, if you have those questions that you need to get answered, reach out to me. Or I can help you connect with our presenters and get some answers around some stuff that you weren't able to ask today. But I want to just say a big thank you to our three presenters, Jasmine, Jamil, and Brian. Thank you so much. Your time and contribution to today is very much appreciated. Um, and thanks for everybody attending. And as a reminder, the slides will be shared via email with all the attendees, and the recording will go up on the website. So you have it as a reference anytime you need following today's session. So with that, I'll say happy holidays to everyone. And we'll see everybody in the new year. And we just do a big send off. Bye.